Thing is, the United States has the most expensive healthcare system and some of the worst healthcare outcomes, at least when compared to similarly wealthy countries. Good portion of that poor performance is related to inequities within the system. Another likely factor in the industry's poor performance is the preponderance of energy devoted to administering the care network and the monetization of the system. I actually would reverse those two. I think the monetization is probably the more salient factor here. So what are we talking about here? Well, there's a study by the Commonwealth Fund for 1922, and it says the healthcare from the global perspective, accelerating spending, worsening outcomes. And here's some of the highlights. Healthcare spending, both per person and as a share of gross domestic product, continues to be far higher in the United States than in other high income countries. Yet the United States is the only country that doesn't have universal health coverage. The US has the lowest life expectancy at birth, the highest death rates for avoidable and treatable conditions, the highest maternal and infant mortality, and among the highest suicide rates. US has the highest rate of people with multiple chronic conditions and an obesity rate nearly twice the average. Americans see physicians less often than people in most other countries and have among the lowest rate of practicing physicians in hospital beds per 1,000 people. So on the happier note, screening rates for breast and colorectal cancer and vaccination for flu are among the highest among this range of about 10 countries that they're looking at. But COVID-19 vaccination rates trail many. So what are we talking about here? Well, let me bring this down so I can actually see it. The United States per capita spending in 2021, $12,318 per person. And the next highest spender was Germany with $7,383 per person. So that's pretty close to double that. And Germany was on the higher end as well. So it's really about double what most countries are expending. And a lot of these really have much better outcomes than we have in this country, right? And I put the list over there. So one of the things that they're saying is access to care is especially unfortunate in this country. And I imagine a lot of people in this room have been noticing that access to care has become more and more problematic. I went to schedule my own physical, and it's January. What is now? It was September when I made the call, and they can see me in January for a regular physical. It's astounding, really, that we have such so many problems, and that's a simple one, right? So we also have so many complications with the insurance aspects of care. We were at dinner with a bunch of people that were involved in medicine, and one of the guys I was talking to was part of a group in an office, and he was saying, 20 years ago, there was a reception person, and that was it. Now there are 13 people doing administrative tasks for their small group, right? Because they have one person who's calling the insurance companies to get pre-permissions, somebody else who's calling the insurance companies to say, why didn't you pay us what we owed you, what you owed us, somebody else calling for appointment reminders, somebody else goes on and on. So the number of people involved in the non-care aspects has just been growing, right, for them. Now, mind you, the other thing that's been growing is consolidation. So one way that groups are able to kind of lower some of their administrative costs is by joining together. So anyone part of a local group like Northwell? Thank you. And ones? West Med, right? Right. So you have a system now that is kind of this really down to about four large groups that are providing most of the care and organizing most of the care in most of the country, for that matter. And when you have that level of industrialization, if you will, of the healthcare industry, you're bound to have some unfortunate effects in terms of the care that people actually receive. So one of the things that they found is that when there's consolidations, it does in fact drive down the payments that hospitals get for care. Unfortunately, those savings have not been going back to the people who are paying the premiums, right? The premiums have continued to rise. And what is probably on the increase is the finding ways to reinvest money that hasn't been spent on healthcare in other kind of vehicles, either through reinvestment or through other kinds of investments to get some additional cash in the door. The main thing is, though, by consolidating, they're able to control the markets much more deftly. And what they find is when there is consolidation and they get things moving, there is a tendency, I got to find the name of it now. It's not monopoly, it's monosopy. Anyone familiar with that term? Basically, it's where the gathering of resources winds up driving down both the price and the amount of services that are delivered, and most often reducing the quality of those services as well, right? So one of the dangers of these consolidations is when a group gets that much influence, there is a tendency to look for more cost savings and to impose more restrictions on care so that they can see a higher level of return on their investments. Now, the thing is, people are pretty unhappy with the system as it is. So here's why isn't this working? Thank you. I have a touch screen, but it's decided not to respond to my finger. So there you go. All right. So this is the I think it's a CNN poll or one more there. It's more than 70% of Americans feel failed by the healthcare system. Oh, this is a Time poll. Harris poll shared exclusively with Time. More than 70% of Americans feel failed by the healthcare system. And what were people's concerns? That the system is too focused on profit, that they have problems accessing insurance coverages. It was unaffordable. The difficulty understanding what's covered through insurance, disjointed, fractured system, inequities and biases within the system, lack of primary healthcare providers, depersonalization, and poor customer service, lack of healthcare specialists. And when asked the question, how, if at all, is the healthcare system not meeting your needs? People responded, it takes too long to get an appointment. Healthcare costs strain my family's finances. My insurance doesn't cover the costs of enough services. The healthcare system is only focused on treating illness and injury, not preventive care and wellness. Quality of care in my community is not good. There are enough providers in my community. Providing the care I need is confusing and hard to navigate. I have to coordinate care across too many providers. I don't always understand the information or recommendation healthcare providers are giving me. The thing is, it's not just patients who are unhappy. It turns out that the providers are increasingly unhappy as well. There we go. Let me get down where that is now. Oh, sorry. I wound up finding a lot of really interesting articles, but that also means I'm a little hard finding the part of the this piece here. So the main thing they're finding is that the rate of burnout is increasing, and that the rate of people feeling like they're ready to leave their profession is increasing. This is true for doctors. It's especially true for nurses, which is, I think it was over 40% of nurses said that they're prepared to leave their profession. And you have a kind of a cascading problem here where you already have shortages The insurance companies aren't that thrilled about bringing in a lot of people in the system because that's a high cost level for them. Meanwhile, people are struggling to get the kind of care that they need. Right? Well, the thing is, how did this come to be? Well, a good chunk of the issue, to my mind, happens because of the monetization of the system. In the US, more than any other country, is based on private healthcare insurance. And why is that? Well, back in the 1940s, early 1940s, the Warburg Board instituted price controls on wages, right? So what they're trying to do is make it so that all the things that need to be manufactured for the war effort would continue and there wouldn't be disruptions. And they were worried about strikes and other kind of things. And they wanted to make sure that everything was running smoothly. And so they instituted basic um, places, wage amounts for different kind of jobs, and also wage caps for some jobs. And so what happened was these things kind of stayed in place after the war was over, and the employers were struggling to recruit employees because there's a lot of competition, but they couldn't raise the salaries that they are offering because of the caps. So what they did find they could do was provide fringe benefits, things like health insurance. And the War Board had made it so that the health insurance premiums would not be taxed. So this way, the employers could actually give this. It wouldn't count as their salary and income in that regard. They wouldn't be taxed on it. And that would make their jobs more likable. And this wound up being a very popular option among employers. And it still is, I might add. And then after the war effort is moving along, there was an increasing worry about the country going communist. And Eisenhower, and his effort to avoid the socialization of medicine, really doubled down on helping people get private health insurance through their employers. And so now I think it's like 70%, 65, 70% of health insurance is through our employers now, something along those lines. And for the longest while, it was really going along pretty smoothly, except that then the premium started rising pretty dramatically, starting in the 1970s. And so we're getting these double-digit increases. And so the companies started getting nervous about this and looked for a corporate response to that, which was the managed care setting, right? Which was really more managed cost care. And that grew, as did the level of shared payment for their premiums. Like especially if you have a family, you're going to be paying for your premiums, increasing the deductibles and those sorts of things. So it's become increasingly more expensive for each person to have health insurance over the course of time. Now, the Affordable Care Act really helped reduce, kind of, what's the right word? Reverse a few of those trends, right? By inciting greater competition, by instituting a system whereby the providers needed to show that they had 80% of their expenditures were related to healthcare. And if there was more than that, then they had to rebate people, right? So that was a nice help on that front. And then with the pandemic, there was a huge influx of cash coming in, and an increase in Medicaid and that sort of thing. So we had a lot more people covered by health insurance and a lot more people able to get care in a way that was affordable for them. That actually is done, right? So a lot of the things that were put in place during the pandemic have now ended. And so the many states now are clawing back a lot of the Medicaid accounts that people were able to utilize when they were during the pandemic. And because a lot of people got Medicaid because they weren't working, a lot of these folks are now working, and so they're no longer eligible. So if they do the eligibility check, most likely they're not going to be eligible for that insurance. And then people have to go back to the market, et cetera. It's not a good scene, right? Now, the thing is, this whole thing, to my mind, is driven more by market than by healthcare needs, human needs, right? In other words, people, they really need to be seen, they need to be diagnosed, they need to be treated. And those things are taking a bit of a backseat to marketing, to controlling areas of healthcare so that you could have a good bottom line and in terms of getting a lot of cash in the door, those sorts of things. And I think that's having a pretty unfortunate effect on people's actual care. And it's a bit independent of people's fame and fortune, apparently. I don't know if people remember 2017, Serena Williams gave birth to a child. Did people hear this story? So she gave birth via cesarean section and afterwards was developing complications. She was getting these pains, but she recognized these pains because in the past she had had embolisms, and that they needed to be treated and they were life-threatening. And so when she got these sensations, she knew what it was. And so she went to the nurse and said, look, I really need to have a CT scan with a particular view, and I need to be put on heparin drip right away. The nurse thought, well, maybe she's a bit delirious from all the pain medications, so I'm not going to follow this. Ultimately, she got the doctor to agree to at least do what did they do, a sonogram, which of course turned up nothing. And so with that, she continued to have pain. She finally convinced them to do the CT scan, and lo and behold, there were the embolisms. They put her on heparin drip. She survived. Is still thriving with her daughter and her husband, I'm sure, and that goes along. But why was that necessary? Why wasn't there a better ear for this person? All right, and that's just somebody who's famous and known to be like really very in touch with her physical state, and who had an actual history that she could rely on so that she could tell, right? There was an absence of the human touch, right, of the human awareness of connection and saying, okay, I'm really listening to you right now, and let's see what we can figure out together. And I think it's what happened when instead of healing art, you're having a healing industry, right? People have protocols that they'll follow as opposed to really practicing the art of figuring out what's going on with someone and doing something about it. Now, sadly, there's another very local instance of this kind of problem with our own Maggie Voltaire, who a couple months ago suffered a stroke. The thing is, it seems that there were things that really could have been done when she was at the hospital that weren't done, or certainly weren't done in time to prevent her from having significant issues with walking and use of her arm. And on the other end of it, the rehabilitation was kind of cut short by the insurance company. So she had a time in Burke Rehab, then she had time in a nursing home, and then the insurance company said, okay, we're done. And when the nursing home went to figure out where she would go next, they realized that Maggie's apartment didn't have any running water. All right. This was not a reason for the insurance company to extend her stay. Right. So off she went back to her house with no running water. It's a system that isn't really taking human needs into consideration in a big way. And I have another example, which just came to me yesterday. So I have a friend, we've been friends since we were in Cub Scouts together in second grade. And he lives in Sacramento, California with his husband. And actually, this is the first wedding I performed was Stephen and Dale's wedding in Chicago many years ago. Anyway, his husband has been having a lot of health problems, especially mobility problems and energy problems. So he would be sleeping for hours at a time. And he was having trouble walking. He wound up using a cane and I think a walker at some point. And it was kind of getting looked at and worked on, but they weren't able to quite figure out what was going on. But he was seeming to get a little bit better with some of the treatments. However, he suddenly had a turnaround where his blood pressure spiked and he was having lots of trouble breathing. And so he went to the hospital, and at the emergency room, wound up saying to somebody that he really didn't want to eat, and actually didn't really want more medical care. He was just so worn out by all the care that he'd gotten so far. So he just wanted to be left without that. The hospital staff determined that he was thereby suicidal and a danger to himself, and so committed him to a psychiatric hospital. Now, the thing is, my friend Stephen is a lawyer. My friend Stephen had an advance directive. He had a power of attorney and other kind of things that he could bring to the hospital. And they never let him speak to the staff that made the decision. They never called him ahead of time. He said, if we were a heterosexual couple, I think he would have called me, right? And didn't get an answer to that. The kicker is they sent him to the first hospital that would accept him, which they said was the rule. Any hospital in California that would accept him would be the place where he went. 3-hour drive. Now they live in Sacramento, which is the state capital, right? 3-hour drive to get to a psychiatric hospital is just unconscionable. How can this be? How can this be something that is truly meeting human needs? So what are we to do about it? So the first thing is, quite honestly, if we had more universal health care, a lot of these issues would go away, I think, right? Because you wouldn't have the same kind of market forces driving the decision making, right? The other thing is, if everyone had kind of pretty much the same health care, chances are those people who are well-resourced would not put up with substandard care, right? And so that really winds up helping everybody. And to be honest, a universal system is a lot less expensive than what we have right now, right? Because right now we're paying a lot of people a lot of money to do things that have no connection at all to the actual care that we receive on the other end, right? The other thing I think that we could really do is be good advocates for ourselves within our own healthcare provider network, right? When you're meeting with your doctor, make a point of making a connection, make a point of having a real conversation. And I can't stress this enough, that the job satisfaction for our providers is very low. And one of the things that really promotes satisfaction is a sense that what they're doing is worthwhile. What they're doing is making a difference in the lives of the people that they're treating. And to do that can really help get at least a few fluctuations up the line. Now, in our current political standoff, it's hard to imagine that universal health care is going to be on the table, certainly in the next couple of years. But I think we can at least support the effort through the ACA to get more people covered and to endorse the notion that everyone at least deserves to be given a fair shake on the healthcare front. Thanks.
Thank you, Bart, and thank you for your presentation today. I think there was a lot to chew on there. We have a chance now as a group to offer our thoughts on today's topic, and you're more than welcome to raise hands and speak. Lanny? Kevin, are you going to circulate a mic?
Is this thing on?
Okay, Michael Yellen has the microphone, so you'll be next.
So, as a retired eye doctor, this hit close to home. And one of the reasons I retired is not because I didn't like what I was doing. I loved it. And I loved my patients. I think they felt likewise to me. Somebody would come in with an issue and they would have their insurance through their employer, whatever it might be. And you couldn't do anything without a further requisition from them, which just never came. So you ended up treating the patients for virtually nothing because you were not going to get reimbursed from the patient. You weren't going to get reimbursed from their insurance. And that went on and on and on with different insurance companies over the time. And the answer to this is exactly what you said, Bart. We need universal health insurance, period. We are one of the richest countries in the world, and we do not have universal health insurance. My oldest child, who lives in Vancouver, BC, Canada, with 2 children, who are very active boys, often prone to injury. There's no cost. You go to the hospital, they say, thank you, have a seat, we'll take care of you. The drugs are free, the medications are free, the doctor's free, the hospital's free. I don't understand why we have the richest country in the world, probably, and we can't have universal health care. If I was going to vote for anything, I would vote for the next fellow who said, let's have universal health care.
Lenny?
I have always been a pro universal health care person too. And I am an advocate and have been for years and years about managed care so that someone is kind of paying attention to the whole picture. However, my son and his wife moved to England, which was one of the first countries to ever have universal health care right after World War II. They've lived there for 22 years. Amy got pregnant and they were living outside of New York City, although Ted worked for the university in London. And they couldn't find a doctor, an obstetrician, or a hospital that would take Amy. They weren't taking new patients. She ended up coming back here and a couple of weeks before the due date had her baby in Boston. But and by the time Theo came along, they were in London. The system had to provide care because Ted worked for the University of London, and she had her baby at University Hospital. In the 20 years or so that they've been there, the government, the conservative government, the Tories, on their austerity program, have cut and cut and cut and cut to the healthcare system. And now the NHS, which used to be so famous and held up as a model, has become a horrible nightmare. When my son was diagnosed with leukemia at a hospital in North London, and then he was diagnosed at that hospital, and it took a long time to diagnose it. He didn't. He was having health problems for probably 10 years. But that's nobody's fault. He went to a million places. Finally, a wonderful ER doctor from Africa someplace said, I don't like your blood work here. He was kind of misdiagnosed with a kind of leukemia that had transformed to a lymphoma. He was referred then to a cancer research institute in London, which now manages his care, and it's wonderful. But if he were not, it takes the same here. It takes forever to get an appointment, months and months. You never see the same doctor twice. You've all read about the nursing strikes, the physician strikes. in England over the past year, because it isn't that the government, as everyone says here, oh, the government is going to tell you that you can't have the operation. It's not the government that dictates your care, but it's the government that limits through austerity programs, cuts the budget for the whole NHS, and everybody suffers, although they suffer equally. A lot of people who can afford it, including my son and his wife, carry supplemental private insurance. So, in a pinch, they can take advantage of the doctors in Harley Street and all that. But the universal healthcare system, at least in England, and I don't know about France and Sweden and here and there, is really suffering.
I want to say a couple of things myself, if you don't mind. One thing I think also is the death of unions. The death of unions, 30, 40, 50 years ago, we had a lot more union positions and they could bargain for benefits. Now it's much, much less. I myself, I got hurt at work. I sprained my ankle. I tore some ligaments. This happened, 3 or 4 months ago, right? I go see, okay, it's a workplace accident, right? It's covered under OSHA and all this stuff here. I go to see a doctor. Oh no, that, I went to like 5, I call like 8 or 9 doctors, foot doctors that had treatment. Oh no, we don't take workplace accidents. We don't take this because they don't want to take it because they don't get paid. The government drags their feet. The C doesn't want to pay. It's like 10 years of paperwork to get your money back. So no matter where I went, it took so long to find a doctor who would take me. All right. All right. Then it's like when you get to choose a healthcare system, like I have a choice of 3 or 4 different plans I can choose from. And each book is like this thick,
Yeah.
and unless you have a pre-existing condition, like heart disease, something like that, you can't really sit down and compare them. It's impossible. Say, well, this one gives you better healthcare than this one. This one you pay more for this one, but you get less. It's impossible. And done that way purposely to make it very hard to choose which one's the best.
I am a Medicare oriented patient, and actually tomorrow I go for my wellness exam, which is the equivalent of the annual physical. I enjoy the wellness orientation of Medicare, which shows the promise of a universal system. My exam will be with a nurse practitioner because I had a pre-op physical in the last year, a doctor who was more junior in the practice. So there's a lot of triaging that goes on. Physician's assistants, I think, are a very good development. They need supervision, but they tend to be younger and more inquisitive. I also found out that there are 2 types of visits. You can go and get a short visit or a long visit. These doctors are monitored by how much time they have to treat. And my daughter had a very good friend who went into emergency medicine and left a hospital in Texas because they were allocating his time to deal with an emergency where he has to find out what's wrong first before he can treat. So he went to another hospital where they didn't regulate that so much. Thanks, Bart, for your presentation. Very thoughtful and thought-provoking. And maybe to give another spin on consolidation, as with capitalism going to socialism, the development of the economy is necessary. Russia and China didn't do it. If we develop hospital centers and holding companies it's a much easier system to nationalize. If there's a big political will to nationalize, that'll be certainly fought. But I think it's universal health care is an objective, but nationalization may be the political action that's called for to get there.
Hi, thanks for your bringing up this subject. I just have a question. What is the Affordable Care Act? And there was so much that went up to the Supreme Court to be found to be constitutional, as far as I understand. But why aren't we feeling that we have affordable care? What do I miss? As opposed to universal, your suggestion, I don't think in this country will ever
The
have.
whole act was not taken down, just the insistence on universal coverage. Trying to remember what it was now. There was one element, an important one, that the Supreme Court struck down, but most of the ACA is stood in place. And so the marketplaces are still there. Well, the question is, what would it be like if we didn't have the Affordable Care Act? It's, yeah, but it did reduce the, increased the transparency of spending from insurance companies, so they have to show what they're spending on. And it also insists that there's an 80-20 rule, so that only 20% of what they take in can be spent on other than direct care. And that if you exceed that, then you need to refund people, right? So that's a significant change, I would think. I don't know if it hasn't actually ultimately reduced the expenses for people. The insurance continues to rise, and is probably going to rise pretty steeply over the next couple of years again. But it probably is holding down some of that rise somewhat anyway.
It's also subsidized, right? It's Medicaid subsidized. So that's what we've done.
If you're, you got like maybe $10,000-$15,000 per year, something basically goes. So what's happening is for certain people had them and got a lot of, but these are such that basically there's the funding is not enough to basically subsidize or basically don't get it subsidized. Not really a bunch. So that's eligibility for Medicaid. Well, I mean, it's connected.
Yeah, use the microphone so folks on the.
I just asked, does it, because you talk about funding, is that related to the Medicaid eligibility standard or cutoff, as far as you know, understand?
Well, Medicaid was expanded as part of the Affordable Care Act in most states, in many states that accepted it. But beyond Medicaid, Affordable Care Act subsidizes people who are, Medicaid is mostly for people below the poverty line. There is a band of people that are just over the poverty line that the Affordable Care Act does subsidize and makes care very much more affordable for them. But those subsidies get very quickly cut off. And if you're in the middle class, basically your subsidies are cut to almost nothing and it doesn't help you. And that's the big problem, but that's really not a fault of the Affordable Care Act as much as it is just the funding of the Affordable Care Act.
I don't have a solution, but I will make an observation that as a business, when people study medicine as a business, right, it's very bedeviling because everybody wants to look at supply and demand as a business model and so forth. But really, medicine, the supply and demand business parameters for, let's say, preventive care is very, very different from end-of-life care, which is very different from emergency room care. And rehabilitation, for instance, is different than all of them. So trying to get models, a business model, be it socialism, capital, whatever you want to do, it's very difficult because everybody assumes it should all be on one package. Well, they have to figure out a way that accommodates the differing supplies and demand factors. Because once you try to put it into a whole one big package, you get paperwork galore.
I thank you for the presentation. I just wanted to mention that all of these things basically depend on political will and the political will that comes from the populace. The National Health Service was started in England because there was a Labour government that was committed to universal health care. Even Medicare came about because of really one amazing year in the history of Congress when Lyndon Johnson had a great majority and could push through bills that had been really dormant for years. I think universal health care was first proposed under President Truman. So it's been around for a long time. And I think the doctor said he would vote for a candidate that supported universal health care. Bernie Sanders has vigorously supported universal health care.
I think Rita,
Oh,
Rita?
Rita.
Oh, all right. The one thing if you remember some guy saying repeal, replace, the first thing I do when I get in the office, the first week, I'm going, you got the best healthcare in the world. Remember somebody said that? Oh,
Rita. She's.
oh.
Rita, okay.
She's. You're circling around her.
Just real quick about affordable care and subsidies and so on. And I guess the subsidies could end at some point. They're not going to go on forever. They have to be renewed. But anyway, as an example, our daughter does get a subsidy and it does help a lot. She pays about $80 a month. Her subsidy amount is somewhere around just under $300 a month. So quite affordable for her.
Good morning, Bart.
Sorry, the difference in the healthcare system in this country, when you have the CEOs of hospitals making $15 and $20 million a year, plus subsidies like apartments and cars and everything else, and yet you're paying nurses' aides $20 an hour if they're lucky. So somewhere in the system, whatever way you want to call it, there's something inherently wrong with this when you have this kind of discrepancy that is affecting the care for the patients, because it's diverting all those funds away from what should be decent salaries for the different levels of staff and into, diagnosis and care for the patients. And
Any other comments? Are we done? Oh, wait.
There's somebody on screen, I think.
Sue?
Oh.
Hi, it's Richard and my video's not working.
Who's that?
Richard.
Yeah, hi. Good.
Hi, Richard.
Just as background, I'm a veteran and I go through the veterans healthcare system, and that's a wonderful model that you can bounce off because they don't put me through any insurance requirements. They don't go through all the nonsense where the doctors have to fill out as much paperwork, and it works. So we could take a look at a model that works and what's wrong with a private healthcare system where you have insurance companies that are making medical decisions, et cetera. So anyway, we do have a model that works for several million veterans. And we can take a look at what works there and what doesn't work in the private sector.
Thanks.
Okay. All right. Well, thank you all for your comments and participation in the topic for today.